Presenting a new series, Medically Verbal, where we'll solve case history in just a couple of minutes. Case 17. Chief Complaint. A 60-year-old male presents to the emergency department with sudden onset of right-sided chest pain and shortness of breath. History of present illness. The patient describes sudden onset sharp chest pain, localized to the right side, worsened with deep breathing or coughing. He also reports associated shortness of breath but denies fever, cough, or recent trauma. Past medical history: hypertension, hyperlipidemia, coronary artery disease. He is currently on amlodipine, atorvastatin, and aspirin. He doesn't smoke and he is not an alcohol user. His father had a history of myocardial infarction at age 65. Physical examination shows BP 140 systolic, 90 diastolic, heart rate 90, respiratory rate 20, temperature 36.8. His cardiovascular region shows regular rhythm with no murmurs. Respiratory region shows decreased breath sounds on the right side. Abdominal region is soft and non-tender. Initial differential diagnosis: pneumothorax, pulmonary embolism, pleurisy, acute coronary syndrome. Based on this presentation, what do you consider the most likely diagnosis and what further investigations or management steps would you recommend? Pneumothorax is air leaking into the thorax due to any trauma. Pulmonary embolism is whenever the clot is circulating throughout the pulmonary circulation. Pleurisy is inflammation of pleura, and acute coronary syndrome is when the blood does not reach to the heart or there is limited blood supply to the heart. If you're thinking acute coronary syndrome, then you are right. What investigations would we do to diagnose it further? We'll perform an ECG to see whether there is an ST segment elevation or any other pathological changes. We'll check out for troponin. We'll perform a chest X-ray so that we could find if there is any pneumothorax or pleural effusion which could be present with cardiac symptoms. We'll perform an echocardiogram to check any structural abnormalities present in the heart. We'll perform a spirometry test to see any pulmonary conditions that might be just elevating the symptoms. For management, we'll start him on aspirin and nitroglycerin for antiplatelet effect. Nitroglycerin is for pain relief. We'll administer him on oxygen therapy if we find hypoxemia. We'll provide them with a reperfusion therapy. Now, this is according to what we found on ECG. A thrombolytic therapy could be done or an urgent coronary angiography with percutaneous coronary intervention. What is percutaneous coronary intervention? It's non-invasive. Okay, we take a catheter, we make a slit on the leg, we insert it through the artery all the way to the heart, and when we find the blockage, we inflate the balloon there so that we could compress the plaque. Now, once the plaque is compressed, we'll put covering over that plaque so that the plaque doesn't fall or the plaque doesn't in any manner spread out. We'll place stent or we'll place a mesh over that plaque. Then for monitoring and supportive care, we'll check their vital signs regularly and the cardiac rhythm. We'll provide them with beta blockers, ACE inhibitors. Hope you like the case study of today. You can come back whenever you want to sum it up. Please make sure that this is not a substitute of medical advice and is just for understanding purposes of how to diagnose and solve case histories. Thanks for watching. Corrections or suggestions, comment down below. Make sure to like, share, subscribe, and hit the bell icon to never miss another update.